giant colon, you will see all of the diseases that can affect this organ. But don't worry, as you'll see, the good news is that it's very easy to prevent all of these diseases, including cancer. So, prepare yourself to journey inside the giant colon. You'll see everything doctors might see when doing a colonoscopy. But supersized!
Here we are. This is the giant colon. So we're going to talk about colorectal cancer screening and the Yukon Colon Check Cancer Screening Program for colorectal cancer. And we're going to have a walk through the giant colon and talk about what a colon looks like, what a normal colon looks like, and what are some abnormalities that can happen in a colon. So come on through. We're going to enter by the bum. So we're going to go up the rectum. This is like the entrance. This is the anus or the bum. And here, the very first thing you see around the rim of the anus are some external hemorrhoids. So hemorrhoids are basically just a nuisance. They're benign, but they can cause, itching and discomfort, and sometimes bleeding. Sometimes blood can appear. So these little knobs here are the hemorrhoids around the bum. Let's go inside. And here we are, something like 8 feet high and about the same around. This is the inside of the colon now. And you can see the lining of the colon. It's lined by what we call mucosa. So it's kind of like the inside skin of the intestine that runs all the way up from the colon, all the way up through the small bowel to the stomach. So here we have some more knobs, which are also hemorrhoids. These are called internal hemorrhoids because they're inside, and they're usually they don't usually cause any problem except occasionally can cause bleeding. So again, it's one of the possible causes of blood in the stool. We're going to go a little bit further inside then, into the heart of the colon. Here we're still in the kind of the rectal area, and you see still a few things sticking out. Here we have a picture of what represents a cancer. So this is a cancer that, as you can see, it's close to the outside. So this is really quite close to the anus. This would be a rectal cancer. And if we took this down to kind of a normal size colon in a person, this would be a cancer that could possibly be felt by a physician or a nurse examining a patient with a digital exam. So in other words, a finger up the bum might actually be able to feel this cancer. So some cancers are actually close to the outside and actually can be felt by a healthcare practitioner. So this type of cancer can also cause lots of problems. It can be so big that it actually can obstruct the bowel. It can cause bleeding, it can cause pain in the rectum, or abdominal pain, and this is a cancer that can spread elsewhere in the body as well. So this is what we want to prevent through the FIT screening program, through the colorectal cancer screening program. And what the screening program is it's a two-step screening. The first step is what we call a FIT test, fecal immunochemical testing, which is really looking for evidence of blood in the bowel. So we look for microscopic blood in the poop or in the stool, and that's by one simple test, taking a small sample of poop or stool, which you can do in your own bathroom, and putting it into a little container with liquid in it, and taking it to the health center or the hospital laboratory, where it's processed in the Whitehorse Hospital laboratory. And really we're looking, is there blood or is there not blood? And if there is blood, that's a possible sign of cancer. Blood can be from many other causes. It can be from the hemorrhoids that you saw. It can be from polyps, which we're going to see later. It can be from inflammation. Can be from lots of different things. But the thing that we're trying to prevent is cancer. So if there is evidence of blood through the FIT test, then the second step is a colonoscopy. The colonoscopy is a scope up the bum looking at the colon. in the same way that we're kind of imagining it with this walkthrough of the giant colon. So we're going to look a little further in, and here we have all kind of things popping up. So we have, for instance, on the right here, we have diverticulosis. Some people may have heard of diverticular disease or diverticulitis, and that's a type of inflammatory, an inflammation that's caused by little pockets or almost holes in the lining of the gut that develop over a long period of time. We tend to see this in older adults, sort of middle age and beyond. And it can be a cause of bleeding. It can be a cause of sometimes obstruction of the gut, of inflammation, and sometimes diarrhea or changes in the bowel habit. So that is not cancer. So it's a different process, but sometimes it can be it can have the same very similar symptoms to cancer. It's treated somewhat differently. It's treated in various ways, often sometimes just by rest, by antibiotics. It can settle down. Sometimes when it gets major, when there's major inflammation or obstruction, surgery might be required. Okay, so here we are. We're moving further up, further up into the colon. Now we're well into the colon, and what we come across right here, what looks like a mushroom coming out of the wall of the bowel, and this is what we call, this is a polyp. This is a very typical polyp. Some polyps, there are all kinds of different polyps. This is a polyp that we call pedunculated. It means it's on a stem, and so it literally is attached with a stem to the wall of the bowel. And this is a kind of a polyp that could, over years, develop into cancer. So the idea of screening, when we pick up blood in a bowel and then we do the colonoscopy, we're really looking for polyps that can be removed before there's any chance of them turning into cancer. So we're really trying to catch cancer either really early or before these guys are even thinking of turning into cancer. And then we're preventing, therefore we're preventing cancer from occurring in the first place. So if we move up beyond this polyp, you really see in this view as we ascend up the colon a kind of a view of all kinds of different polyps, different sizes of polyps, different types of polyps. So for example, these polyps here are more, they don't really have much of a stem. They're more kind of directly attached to the lining of the bowel. Different kind of polyp, but still it's a type of polyp that can develop into a cancer. Now, of course, not all polyps develop into cancer, only a few of them, but it's hard to tell which ones will develop into cancer and which ones won't. And that's why when a scope is done, when a colonoscope is done, if a polyp is seen, it's removed at the same time. They're snared with a wire and then simply sliced off and taken away. So coming up here, we see another one of these mushroom types. Another one, and a few more here. And then, as we come, we're now about halfway through, so we're a good 20 feet into this giant colon. We see something completely different. And what we see if we zone in on the wall here, it's pretty hard to see anything different. But sometimes the lining of the wall can get inflamed, and so with an actual colonoscope, you would see kind of a red, angry-looking lining of the bowel, and that can represent inflammatory bowel disease, of which there are different types. One type is called ulcerative colitis. It's an inflammation that it affects the bowel. It can start in quite young age, sometimes teenage, adulthood. And can cause bleeding in the bowel, inflammation and pain. It sometimes can become severe, and sometimes can transform from inflammation into cancer. So people with ulcerative colitis, again, there are different treatments depending on the severity of the disease, but people with ulcerative colitis are usually under surveillance. In other words, they're regularly scoped because they do have a risk of colon cancer. So what we see, this big kind of mass that's stuck on the side of the bowel, the lining of the bowel, the colon, is an advanced cancer. So this is what we want to prevent. By catching a polyp early, we hope to prevent lesions like this of advanced cancer. So advanced cancer, it can spread. It can spread outside the colon. It can spread around the body, and it can be life-threatening. This type of cancer would be staged. So depending on how far it's spread, there are different treatments available. Usually this would involve surgery, possibly chemotherapy or radiation therapy as well, in an attempt to get rid of the cancer. But obviously a lot more complicated, lengthy, and involving a lot more of a burden for the patient to go through to have advanced cancer treated, rather than to have the prevention in the first place, the screening and then the removal of a polyp that could turn into this. So we're going to carry on. So the question is, who should be screened and who should have a fit test? So we're encouraging adults who are aged between age 50 to 74, males or females. Both females and males are equally at risk for colorectal cancer. So we're encouraging all of them if you're in that age bracket and you're having a checkup, that you have a fit test at the same time. So a fit test should be part of an annual physical. Of course, we only ask for the fit test every 2 years, but it should be part of that kind of checkup process. It's preventive medicine. It's very easy to do. But that's the age group, age 50 to 74 age adults. Now, some people are going to be at higher risk for cancer. People with a strong family history of colon cancer, people with some hereditary syndromes, like some people have multiple polyps and have a family history of that, and they may be at higher risk. People with ulcerative colitis, there are people who are going to be at higher risk have a different route for screening. Often they go directly to colonoscopy rather than having the fit test. So what we're looking for are people of what we call average risk. They have no symptoms, they have no particular family history of colon cancer, they have no other inflammatory diseases of the bowel. Those are people that between ages 50 and 74 are encouraged, and we're encouraging to get the fit test every 2 years. So we're going to move further up through the colon, and we're now moving towards kind of the end of the colon. And here we have another type of lesion which looks a bit like that cancerous lesion, but this is supposed to represent another type of inflammatory bowel disease called Crohn's disease. Crohn's disease is a kind of a nasty inflammatory disease. It can affect any part of the bowel, really from the mouth to the anus, anywhere, and often involves several areas of the bowel. Can cause because of the inflammation, it can cause difficulties with absorbing nutrients, absorbing food. It can cause bleeding. It can cause abdominal pain. It can cause weight loss, anemia, and changes in the bowel movements. Again, diarrhea or constipation. So that is another thing that sometimes is seen on colonoscopy. But usually that's going to be in people who already have symptoms. Whereas and again, they will be under a kind of a different pathway of having usually regular surveillance type of colonoscopy, just for monitoring their disease control. People with Crohn's disease aren't at any particular risk for cancer, but can have symptoms that could be similar to cancer-type symptoms. And depending on their degree of symptoms, degree of disease, may and often will have multiple colonoscopies. So it's just an illustration of another type of disease that can affect the colon. As we go up, we're in what's called the cecum, which is like a big round room, and this is the kind of almost a bulbous end of the cecum. So when a colonoscope is inserted into the colon, you kind of know where you are. You know you're at the end of the large bowel or the end of the colon when you reach the cecum, and it's this kind of almost like a ballooning out, a little bit of a ballooning out of the end of the bowel. And after this is the small bowel. So the beginning, well, the end, since we're going backwards, the end of the small bowel that then goes through its various stages, traveling all the way up to the stomach. So there's a sign there that says appendix right at the end, and of course the appendix is attached on the outside. If we take an outside view, you'll see the worm-like appendix attached to the cecum. And the appendix is not really, it's not an organ that has modern use, although it's a common, commonly, of course, people know the appendix because of appendicitis. So sometimes people get inflammation or a blockage of the appendix. They get, and that can give an acute abdominal pain, which requires urgent surgery. So appendix, really the only use is having appendicitis. It's not really a valuable organ otherwise. And that kind of brings us to the end of our tour of the inside of the giant colon. We're going to just walk outside the other end. Normally there's not a hole at the end of the cecum. If there were, you'd be in big trouble, actually. But this is a way for us to come out and then see this end from the outside of the giant colon with the appendix sticking out there, kind of like the trunk of an elephant. So that's our tour of the colon.